Hi,
Hi.
Elena.
Yes, Elena.
Thank you so much for coming. I wanted to take a few minutes and kind of welcome you to the space and cover just a few things that we need to before we can get going. Um, the first thing is that this is a safe space, and you enjoy all the privileges of confidentiality. The only time that I may have to get anyone else involved is if you indicate that you're a threat to yourself or anyone else. I'm also a social work student, and I have a supervisor that I may need to check in with about your treatment. Does that make sense?
Yeah.
So, what's going on?
Well, on your form, you know that I have rheumatoid arthritis in my hands. So that started it started about a year ago, but it got worse very fast. So about 6 months ago, I had to stop working. I was the chief of surgery at Tampa General, and I couldn't do surgery anymore. So now I don't know really who I am or what good I am, and my wife wants to she wants to help, right? And I just shut her out and feel like a ghost in my own home. And so I'm looking for a reason to get out of bed every day.
Sounds like things have been pretty challenging.
Yeah, you could say that. Yeah.
So let's back up a little bit and tell me about how you got to your diagnosis. What were the things that sort of led you to seek the care of a rheumatologist? And
do you want me to get into like the medical stuff, or?
No, I'm just curious how long you sort of suspected that something was going on and what that journey looked like.
Okay, so about 2 years before, I noticed I was getting sick more often, and my hands were hurting. They felt stiff in the morning, and I figured it was, menopause and things, just change over time. And so surgery, I was still able to do it, of course, but starting to get painful. So I tried supplements and paraffin baths for my hands, and I thought maybe it was stress, because I'm over the entire residency program. And I thought maybe I was just up in my head about it. Took a vacation, and it didn't get better. And I guess that was about, a year ago. And then, so I thought maybe I needed a physical therapy or something. And then they said to, start checking for other explanations. And and then we tried to manage it. Really did some aggressive treatment. And I'm a doctor, so I'm pretty well educated about how to evaluate possible treatments, and
Sure.
So I clearly I was in denial for a while, but they did, they did all of the cutting edge treatments, of course, because you know, I have friends, you know, in the immunology department, but I was getting worse and worse, and I couldn't do surgery anymore, and I couldn't maintain my privileges. And so I had to step back and thinking maybe, you know, there would be some sort of clinical test or clinical, you know, trial that I could do that would help me. And maybe I'd get back to it, right? And there's not. I mean, you know, even putting on a shirt with buttons is hard for me. You know, can't button my shirt.
It sounds like it's been a really big adjustment for you through this journey.
I'm not adjusting.
Well, how would you describe what you're doing?
Barely existing.
It's very heavy. It's a really heavy thing to deal with. A lot of changes in the recent couple of years. It sounds like there was a little bit of a ramp up, but this feels a little.
And it feels like the end of my life. Man, I'm not suicidal, but the person that I know that, you know, I mean, this is since childhood, right? Like, you know, everybody said, oh, you'll be a doctor, you're going to be a doctor. My family, you know, and being the chief of surgery, you know, I mean, it's not easy, especially as a woman. And I've fought, not just fought, but it was really everything I had in terms of who I am. And so, yeah, I don't know. What was the question?
No, I was just sort of trying to get an overall sense of where you are now versus where you started when you began your kind of journey to diagnosis. So I heard a couple of things that I wanted to sort of maybe think about. I wonder if we could talk about it together and maybe identify some things to work on. Would that be something that you want?
I mean, yeah, I'm here because I don't know what else to do.
Okay, well, that's a fair place to start. You know, I do want to make sure that we're on the same page. You said that you're not suicidal, but I do have to ask, have you thought about killing yourself?
No. No, because I hate quitting, but I definitely don't know what I have to live for. I'm not going to kill myself. I'm not going to put myself in a situation where I'm going to die or anything like that, but I just don't know what living looks like at this point.
So as we sort of begin this work together, you know, maybe finding meaning in what's ahead of you is where we can spend some time. What do you think?
I mean, I hope you have some good ideas, because right now I don't.
Well, we're going to work on that together, and I think that you probably have some good ideas. It's just very difficult to see because you're feeling activated emotionally about what's going on, and rightly so. This is a cataclysmic shift in your life. And I think...
I don't feel activated, I feel empty.
Tell me more about that.
I feel hollowed out. I feel like a husk. I don't feel activated. I feel... yeah.
Okay.
I feel paper thin.
Okay. Well, again, I think I think if we start at that baseline and we start thinking about ways to find meaning in the mundane and not so mundane, if we try to look for ways to fill those spaces, is that something that feels like you want to work towards?
Feels like something that probably I'm gonna have to do, or have to settle for. I mean, it sounds exhausting right now.
Yeah, I definitely understand that, anything right now would sound exhausting, considering how hard you've worked over the last several years in your diagnosis and sort of dealing with your new reality. I think it is hard work.
Yeah.
The other thing I wanted to ask was, you mentioned at the beginning of our conversation that your wife was trying to be there for you, and that you, in your words, you pushed her away a little bit. Is that what I heard?
Yeah.
How are things now?
I mean, she doesn't try probably as hard anymore, because I'm not saying she's giving up. She's not gonna leave. She loves me. I love her. I don't think that that's the issue. But I just feel like a ghost at home, and doesn't feel very fair to her. And I'm not the person she married. I'm not the person she fell in love with. I mean, I don't think she's gonna leave. That's not it. I just, yeah. And I just don't want people's pity. Can't stand it.
Is pity something that you have experienced before, or is it something that you're experiencing now?
I mean, before, I guess, right after I had stepped back, so 6 months ago, right? Of course, all the other surgeons in the hospital were, calling me and brought me a casserole, all the things that you do.
Sure.
And I just couldn't stomach it, so I dodged their calls, and every time they wanted to meet for coffee, I told them I was busy, which I was not busy. I was in bed. So calls slowed down and don't really come anymore, which I guess is how I wanted it. So.
So it sounds like you've been isolating a little bit from the people in your life.
I mean, I don't know what a little bit is. I don't have anybody in my life really now besides my wife. My career was my life.
And the relationships that you formed with the people that you met as a result of your career, is there a pathway to maintain those relationships without the sort of occupational focus?
It's too painful. It's too painful.
Too painful. It sounds like you've got some very, very strong ideas and opinions about what the future may or may not look like. And I think the work that we're going to try to do here is to break down some of the sort of resistance that you seem to have to.
I'm not trying to be resistant. It's not resistance. I'm just lost.
Absolutely. And when I use a word like resistance, I definitely don't want to make you feel that what I'm challenging is you personally. What I may be trying to sort of push you a little bit on is thinking about things in a black and white way, right? Either it is or it isn't. What I'm hoping to do in our work is to find a way to find some nuance in the way that you define relationships, the way that you define engaging with the things that are important to you and the people who were important to you. Is that something that you would be open to?
I mean, I'll give it a shot. I will give it a shot. I was a good student, and I'll be a good patient. And I don't envy you being in the position that you're in, because I've had some tough patients. Most of them are under anesthesia, but no, I will be a good patient.
Well, a gold star is not what I want you to sort of strive for. What I'd like you to strive for is an opportunity to sort of reframe some of the feelings that you're having and to find a way forward in the goals that you've sort of set.
Okay.
Finding meaning, is working on kind of softening things with your spouse something that you also want to think about, or do you feel like that's too much for this moment?
No, I don't think it's too much. I think that figuring out how I can accept her love and not see it as petty. I don't know how I can talk to my colleagues again, but my wife, she loved me when I was a graduate student. So I know that she doesn't just love me for being the chief of surgery. I know that. And I don't want her to be hurt any more than she already has been. So.
Well, I definitely appreciate that. I think some of the approaches that we're going to try to take are going to be about reframing some of the kind of way that you are approaching the situation. We're going to talk about some cognitive restructuring. We're going to look at things and look at the evidence for and against the statement that you're making. So, for example, am I basing something on a thought or a feeling? We're gonna get very, very granular about how you're making those leaps in your brain, and we're going to do that slowly and gently, and we're going to do it one step at a time. So I want you to make sure that you feel safe in this environment. But first, we're going to spend a little bit of time. I want to get to know you a little bit better. I have kind of the basics of where you are right now. I want to get a little bit more context about your life prior to being a surgeon and more context about your life now. Basically get to know you a little bit better. And then very slowly and very gently, we're going to start approaching these questions. How does that sound?
Yeah, I mean, I don't want you to feel like you have to be, you don't have to, pardon the expression, use kid gloves. I mean, I want to do what works. So.
Well, kid gloves is not a technique that we use here, but this is for you, and this is a collaborative experience. This is for you to engage in as long as you feel it's productive for you. So we're going to approach it in the most gentle but scientific way, so that you see the value in what we're trying to do. In the meantime, I was wondering if you would be willing to do a little bit of work at home.
I'm not doing anything else.
Well, let's give you a little bit of homework.
Okay. Like I said, I was a good student.
All right. Well, the next time that you have an opportunity to engage with your wife in a way where she's trying to be supportive and you feel yourself pulling back, can you make a note of that for me and come back to it with me?
Like a note, like write it down, or
you can make a mental note, you can make a physical note. That's entirely up to you, however is natural for you. But what I'd like is a sense of what happened, a situation, and a note of how you responded. And then maybe we'll use that as a use case to sort of talk about how we can restructure your cognition around that situation going forward, and maybe use that as a learning opportunity. I want to thank you for your vulnerability today, Doctor.